Hello, I'm Dr. Harry Erba, Professor of Medicine, Director of the Leukemia Program at Duke University in Durham, North Carolina. Um, I'd like to give you an update on a very specific subset of patients with acute myeloid leukemia. And those are patients where the acute myeloid leukemia has a specific genetic change known as NPM1 mutation. Nucleophosmin, or NPM1, is a protein that's found in all of our cells. In about 30 to 35% of people with acute myeloid leukemia, this gene can become mutated. You're not born with this mutated gene. It happens by chance, but it defines and actually causes leukemia, and a very specific type of leukemia, acute myeloid leukemia. This subtype of AML typically has a more favorable prognosis. With intensive chemotherapy alone, patients may be cured of this disease. Even people who are not able to tolerate intensive chemotherapy and receive less intensive treatments can have high rates of response and durable remissions with continued treatment in this subtype of disease. However, relapses still may occur after both intensive chemotherapy or less intensive chemotherapy. And therefore, there is still an unmet need in this subtype of AML. It turns out that this mutated form of NPM1 causes leukemia by directing the activation of genes that cause the proliferation of stem cells in the bone marrow and blocks their development into normal blood cells. This process is governed by a protein called menin. And therefore, menin has become the target of inhibitors that will block the activity of menin and hopefully then lead to remissions. And we have seen this. There are a number of menin inhibitors that are in clinical trials, one of which has actually been approved for a different subtype of AML that can lead to complete remissions. Now, on their own, these oral inhibitors have not been shown to lead to durable remissions. And so now we are combining oral menin inhibitors with the chemotherapy regimens that we have used in patients who can receive intensive chemotherapy, or those older patients or those with comorbidities that could only receive less intensive treatment. We have presented the data for one of these, ziftomenib, with intensive chemotherapy at the annual meeting of the European Hematology Association in Milan, Italy on June 12th, 2025. And what I presented at this symposium is that this combination leads to very high rates of complete remission. And these remissions were very deep. And although follow-up is short, so far these remissions have been durable with continued use of ziftomenib with intensive chemotherapy followed by maintenance. Some of these patients remain in a complete remission even though they did not undergo allogeneic stem cell transplantation. And we have found that by the addition of ziftomenib, we didn't increase the toxicity of this intensive chemotherapy regimen. And so now we are embarking on a randomized trial to see if the addition of the menin inhibitor ziftomenib to intensive chemotherapy will improve the long-term survival of patients with acute myeloid leukemia with this NPM1 mutation. That study will begin in the later part of this year, but will take some time to complete. And so there's a lot of activity in targeting NPM1 mutations through their effects on menin, and I look forward to a number of drugs being developed in this area that hopefully are going to improve the outcomes of people with this pretty common subtype of acute myeloid leukemia. Thank you.